Hello and welcome to ECOM the practical, easy, and useful ultrasound resource for general practitioners, the site where we talk about real and authentic clinical cases seen during consultations in a small general practice office. Actually, at the end of my consultations, when I come across an interesting clinical case, I record it on video and we discuss it together so we can all improve. And so you can also see that ultrasound absolutely has its place in a general practice office. In fact, it's even essential. I'm sure it's going to become extremely important in the coming years. And I hope that one day every general practitioner will have an ultrasound machine in their office, because it truly provides enormous benefits in daily practice. So today we're going to go back to basics a little bit with a clinical case that made me think of beginners. And we're going to talk about cysts. And in this video, I'm going to give you the 3 essential criteria that make an image a cyst. That is to say, they'll allow you to confidently diagnose a cyst without falling into the trap, without tripping up, so to speak. Because very often what I hear my residents say is completely wrong, since most of the time people say that a cyst is anechoic and black. But actually, that's not the definition of a cyst. You can have different cystic images, and that's the case today. So, as always, remember to support me. It really helps me a lot. It helps the channel and also keeps me motivated to keep posting little videos for you at the end of my consultations. Because after all, it's always something extra we do on top of our consultations. So even though it's truly a pleasure for me to share this with you, just a little like or comment really means a lot. It honestly makes me really happy every time I see that on the channel. Same thing. If you're on Facebook and you like, is this the kind of content you'd like me to share with you? It really helps me a lot. Just a reminder, right now you still get access to a free ultrasound training, an introductory training that will help you build a solid foundation in ultrasound, exactly what we're going to cover today, the basic criteria to avoid making mistakes, giving false diagnoses, or getting things wrong. The link is in the description. I invite you to join me. It's free, it's available, take advantage of it. I'll see you very soon on the training platform. The clinical case is a woman who comes in with a mass, a soft mass on her index finger, on the dorsolateral side of her index, at the level of her first phalanx, or P1. The mass has been gradually increasing in size over about a year. The growth has sped up recently, which is worrying the patient. So she decided to come see you for a consultation to get your opinion, and then very clearly perform an ultrasound. Since the woman knows that I have the equipment, that's mainly why she's coming. So what does it show? We get this. And now let's take the opportunity to review the 3 criteria, as I mentioned, the 3 diagnostic criteria for a cyst. So the first thing we see is that it's not echogenic. Here we have an image, an echogenic image. This is where the biggest interpretation trap happens, especially for beginners. They expect that when they place the probe on this image, which clinically is clearly soft and therefore suggests a cyst, they'll see a round anechoic image, meaning fluid filled, but they'll be disappointed because in many people's minds, anything fluid filled appears black on echo map. Actually, that's not the case at all. What should really guide you when it comes to something fluid filled is the posterior enhancement, and posterior enhancement. If there's one criterion to remember, it's posterior enhancement, because the vast majority of fluid-filled masses are not going to be anechoic. That's the case with abscesses, and that's the case with epidermoid cysts, like we have here. We'll talk about it in a bit. I'll give you a little criterion, a small tip to help you figure out if it's epidermoid or not. Even though I'll make another video on the topic, I'll give you a little trick at the end of this video. So here you can see that there is posterior enhancement. How do you recognize posterior enhancement? We're going to compare what's on the left side of the image, the right side of the image, and what's underneath our image. You can clearly see here, the image of the subcutaneous tissue is much less echogenic than it is here. As soon as we move to the other side, we again see a less echogenic image. So why do I talk about this so much in my courses, especially the introductory ones? Because it's important to understand what we're doing if we don't want to make false diagnoses. And that's really the issue with ultrasound. When your ultrasound waves pass through fluid, they're not attenuated. They're not slowed down. So as a result, they arrive with more power at the back of this image, and so they're going to cause an artifact. We call this posterior enhancement. I'll refer you to my introductory course, which is available to you for free. You can see here that the ultrasound waves are gradually attenuated, so the image gets darker and darker, so to speak. Whereas here, they're not attenuated by this part and suggest posterior enhancement. And that's the criterion that should make you think of something fluid-filled, and not at all just the anechoic aspect or echogenic. You can see here we have a mass that is echogenic but fluid filled. And I could show you cancerous tumor masses, maybe in another video, that are anechoic or almost anechoic. Clearly, it's extremely misleading. They don't have posterior enhancement. I'm thinking in particular of a kidney cancer I saw in one of my patients, which was actually completely misleading and could have been mistaken for a large renal cyst, but in the end it turned out to be a renal tumor. So that's it for the first criteria. The second criterion, which is very, very, very important, could actually overlap with the example I just gave you. In the patient's kidney, the fluid never shows up on Doppler, so you need to learn how to use Doppler. Here, we're using power Dobner. You need to learn how to adjust your Doppler settings to create artifacts. Here, it's not really flow, it's artifact, because if, when your Doppler setting reaches the artifact, you don't see any flow, and that's what I wanted to get at, absence of flow on Doppler. If you don't see any flow in your image, there's a good chance it's fluid, or at most, something benign. But mainly, remember, it's fluid. This fluid will never show up on Doppler. So, on the other hand, if you're examining a mass like this one, potentially a tumor, be careful. That's exactly what we want to find out for this patient. Is it something tumorous or malignant? Something made of tissue? Something solid? If, when you examine the mass, there's no flow. If there's no Doppler inside, you can be reassured, at least in part, that it's probably fluid. Like in this case here, there's posterior enhancement and it's fluid. There's still one last important criterion you absolutely have to keep in mind. And I really emphasize this a lot in my trainings. The double grid technique. You need to make sure, in both directions, that it's not something tubular. And we'll look at that in just a moment. In an upcoming video, next time on YouTube. Specifically, I thought of a case of galactophoricitis that I'll post for you, where we could have had an image like this. In one direction, but in the other direction, in the other axis, we have something tubular. So always use the double grid technique, a transverse view and a sagittal view. Because you need to look at your image in both directions, study it in both directions, for two reasons. First reason, the relationship of your image, for example here, with the bone cortex, or with the tendon structures. And the second reason, to make sure that this image is a rounded image. Yes, because a cyst is always rounded, even if it might have slightly irregular edges, but it's still rounded. If in one direction you have something round and in the other direction you have something long, then it's not a cyst. If we're talking about the breast, it could be a galactophoritis. If it's in a limb, it could be a thrombophlebitis. And yes, you could mistake something for a cyst and get confused if you only take one scan plane. So always, always, always make at least two scan planes. What I call the double grid, transverse and sagittal. So to sum up the three criteria, and then I'll show you the video. You'll see what it looks like. A video of an epidermoid cyst. And after that, I'll just go back a little to show you the little trick I mentioned earlier. The three criteria are posterior enhancement, rounded shape in both axes, and absence of Doppler flow. And you'll notice I didn't mention being anechoic. I didn't mention it at all. That's not one of the criteria for a cyst. All right. That might come into play later for possible histological criteria. You could say that, even though ultrasound doesn't do histology, but that's not one of the criteria for a cyst. Let me just go back for a moment before I show you the video. What I marked with the arrow view. This linear echogenic border that you'll see in the video right after this, those are hairs. That's what makes us think this is an epidermal cyst, since it originates in the dermis. You can see it's not deep, it's in the dermis. This time, the content is echogenic. There will be small hyperechoic spots that, if you're in the right plane, you can see as elongated structures, which are actually hairs. This is found in epidermoid cysts. You'll see it in the video right now. So here's the video now. This is what it looks like. There you go. You see a rounded image with posterior enhancement, an image that has a beginning and an end, so it's not tubular. An image that nevertheless is echogenic, even though it is indeed cystic. The small echogenic images, so you have to look closely. You can see one here. We'll see another one in a different spot. Okay, here we see the same one again. There's one that appears a little higher up. Well, it's not here. There, we just saw it. It can be a bit hard to see. You have to scan, you have to look for it, you have to take multiple slices. See, here we have a small echogenic image, a second echogenic image, which really makes us think much more of an epidermoid cyst. Here, the appearance is typical, but it's missing a bit of very echogenic, very hyperechoic content. So that's it for today for this clinical case. As usual, give me a like, support the channel, support my work too, if you like it, if it brings you something. If you don't like it, just don't do anything. But if you found it interesting and it helped you, leave a like, leave a comment, like on Facebook, and let me remind you that your ultrasound training is free and the link is always in the description. Bye-bye. See you soon on EcoMan.